Did you know that 1 in 3 people will face cancer at some point in their lives? Here's what most people overlook. Every year, millions of cancer cases are diagnosed too late, all because early warning signs were missed. According to the American Cancer Society, detecting cancer in stage 1 can lead to survival rates soaring above 90% for many common cancers, but if you wait until stage 4, that chance can reduce to less than 20%. In the next few minutes, I'll reveal 8 subtle warning signs that could genuinely save your life. Don't skip it, because the 7th one will shock you. These aren't the usual symptoms everyone talks about. They're the quiet signals your body gives off long before things turn serious. Most people ignore them completely, but recognizing these signs could be the difference between early detection and a late diagnosis. Now, I know what you're probably thinking. Does every little ache and pain mean cancer? If you've ever searched online, it might feel that way. That's exactly why this is different. We're diving into scientifically backed warning signs, not baseless internet rumors. These are the very signs that have helped thousands catch cancer early when treatments are most effective. Stick around because this isn't about spreading fear. It's about equipping you with knowledge that could truly save lives. Let's get into it.
1.
Bone pain. One of the most overlooked warning signs of potential cancer is persistent bone pain. Unlike the temporary soreness you might feel after exercise or minor injuries, cancer-related bone pain tends to intensify over time and often worsens at night. When cancer begins in or spreads to the bones, it disrupts the normal structure of bone tissue, leading to a deep, penetrating ache that's hard to ignore. Primary bone cancer, known as osteosarcoma, typically affects the long bones in the arms and legs. At first, the pain might feel subtle, like a sprain or a muscle ache, but it gradually becomes more severe and constant. Some patients describe it as a throbbing or aching sensation that doesn't respond to standard pain relievers. If you experience bone pain along with swelling, increased tenderness, or unexplained fractures, it's vital to seek medical attention immediately. Catching bone cancer early can make a world of difference.
2.
Body rash. Certain types of skin changes can signal something far more serious than simple irritation. Leukemia, a cancer affecting blood-forming tissues, can reveal itself through distinctive skin symptoms often mistaken for minor conditions. The key lies in how these rashes look and behave. One hallmark sign is petechiae, tiny round spots on the skin caused by a platelet deficiency, a common feature of leukemia. These spots are typically 1 to 2 millimeters in size and don't blanch or fade when pressed. Their color can range from red to purple or brown, and they often appear in clusters, especially in areas under pressure like the ankles or beneath tight clothing. Leukemia disrupts the production of healthy platelets, which are essential for preventing bleeding. Without enough platelets, tiny blood vessels called capillaries can leak, creating these telltale spots. Unlike common rashes that might itch or disappear after a few days, if you notice these signs, it's crucial to consult a doctor immediately. Early detection can make all the difference in addressing leukemia effectively. 3. Unexplained night sweats. Night sweats that soak your bedding and clothes could be more than just a warm room. When these episodes happen frequently and aren't tied to environmental factors or menopause, they might signal an underlying condition like lymphoma. Cancer-related night sweats often occur alongside other symptoms, such as unexplained fever and weight loss patterns oncologists recognize as warning signs. These intense sweats result from your body working overtime to combat cancer cells. The immune system's response to lymphoma releases inflammatory chemicals that disrupt temperature regulation. While occasional night sweating during stress or illness is normal, persistent drenching episodes are a red flag that should prompt immediate medical evaluation.
4.
Jaundice. Jaundice, marked by yellowing of the skin and eyes, occurs when bilirubin builds up in the body. While it can stem from various causes, a sudden onset in adults is often a red flag for pancreatic or liver cancer. In pancreatic cancer, tumors can block the bile duct, preventing bilirubin from being processed and expelled. This leads to bile entering the bloodstream, turning the skin and eyes yellow. Watch for accompanying symptoms like upper abdominal pain, dark urine, or light-colored stools, and seek medical advice immediately if you notice these signs.
5.
Fingernail marks. Subungual melanoma, a rare form of skin cancer that develops under the nails, often begins as an unassuming dark streak known medically as melanonychia striata. This vertical line on the nail demands close attention. This type of melanoma most commonly affects the thumb or big toe, though it can occur on any nail. Key warning signs include streaks wider than 3 millimeters, streaks with uneven or varying colors, or blurred edges. If you notice changes to your nails, especially dark streaks accompanied by pain, nail splitting, or bleeding, seek medical advice immediately.
6.
Persistent fever. A recurring or unexplained fever could be your body's way of signaling blood cancer. Unlike ordinary fevers that subside within a few days, cancer-related fevers often follow a unique pattern and are accompanied by systemic symptoms. Blood cancers like leukemia and lymphoma can trigger the release of cytokines by your immune system, leading to frequent fevers. A hallmark of blood cancer fevers is their cyclic pattern, with temperature spikes at regular intervals. If a fever persists for more than 2 weeks or keeps returning without a clear cause, it warrants thorough medical evaluation. Blood cancers can weaken your immune system, making you more prone to infections. Proper diagnosis involves blood tests to check for abnormal cell counts. Remember, early detection can dramatically improve outcomes. 7. Eye pain. Your eyes can reveal critical clues about your overall health, including potential warning signs of cancer. Ocular melanoma, though rare, is the most common type of primary eye cancer in adults. Its symptoms often start subtly but can progress into more noticeable changes that should never be ignored. When cancer develops in the eye, it may cause unique symptoms that stand apart from everyday eye issues. You might notice persistent blurred vision that doesn't improve with new glasses or unexplained flashes of light unrelated to migraines. The most alarming sign is a dark spot on the iris that changes in size or color over time. Advanced imaging tools like ophthalmoscopes allow doctors to examine the internal structures of the eye in detail. If you have lighter-colored eyes or fair skin, your risk of developing ocular melanoma is higher. Persistent eye pain or sudden vision changes shouldn't be dismissed. Early intervention could save both your vision and your life. Regular eye exams are especially vital if you have risk factors such as prolonged sun exposure or a family history of eye cancer.
8.
Persistent heartburn. Chronic heartburn or gastroesophageal reflux disease might seem like a minor inconvenience, but when it lingers despite lifestyle changes and medication, it could signal something far more serious. Persistent acid reflux that resists treatment is often an early warning sign of esophageal cancer. The link between chronic heartburn and cancer lies in the repeated damage caused by stomach acid to the esophageal lining. Be alert for symptoms like difficulty swallowing, food getting stuck, or unexplained weight loss alongside your heartburn. If over-the-counter medications haven't resolved your heartburn after 3 weeks, it's time to consult a healthcare professional. While these signs don't always mean cancer, they do deserve proper medical attention. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with others who could benefit. Don't forget to subscribe for more informative health content.